This month on Medical Minutes here on Time Warner Cable DMG TV2, we span the Union Hospital complex. We start out with the Ohio head and neck surgeons and Dr. Aaron Brescia. He tells us all about summer allergies. Then it's over to the maternity center at the hospital where nurse manager Donna Morgan tells us how to safely put your baby to sleep. Then we wrap up here at the Healthplex where it's Your Move with Jeremy Klassner.
A nursing home or your own home? It's good to be home, so call Ember Complete Care for all your home health needs. When you're recovering from illness or injury, our compassionate staff promotes healing in the most comfortable environment of all, your own home, for skilled nursing, physical therapy, wound care, and more. Locally owned and operated, Ember Complete Care has been servicing all of Tuscarawas and Coshocton County since 1986, with a yearly average of $75,000 donated back into the community. Call 1-800-462-0909. Ember Complete Care. It's good to be home.
Myers & Miller Podiatry provides complete foot and ankle care to patients of all ages. The practice was established in 2000 by Dr. Adam Myers and has grown to include Dr. Andy Miller in 2007 and most recently Dr. Jason Backage in 2010. Our core values of respect and honesty are the basis for how we manage our practice, and we have grown by building relationships with our patients in order to better serve their needs. Myers & Miller Podiatry serves Tuscarawas and Holmes County with offices in Dover, Sugar Creek, New Comerstown, and Millersburg. Let's get started building our relationship.
Hello, welcome to Medical Minutes here on Time Warner Cable DMG TV2. And we are on location for this segment with Dr. Aaron Brescia. He is with the Ohio Head and Neck Surgeons in Dover. And Dr. Brescia, we're going to talk about allergies. Ohio Head and Neck, that's ear, nose, and throat?
Yes, the official name of our specialty is otolaryngology head and neck surgery, which is a lot to say. But traditionally, we were known as ears, nose, throat doctors. Mm-hmm.
And so allergies are really bombarding our area. Is this just the time of year?
Well, the Ohio and Mississippi River valleys are the worst, some of the worst in the country for allergies in general. And certainly during the spring, summer, and fall, you have all of the tree and weed and grass pollens that you don't have in the wintertime. So we usually say that when the first few frosts come in the fall, that kills off a lot of the outside allergens. And then you're just left with things like dust, cats, dogs, tobacco, year-round exposures. But certainly then in the spring, again, trees, and later on in the summer, grasses, and in the fall, more weeds become a real issue for people in this area.
But people are allergic to different things. Different people are more sensitive. Why is that?
It's just the way that somebody's chemistry, the blood chemistry, has reacted to some of the things that people are exposed to. So there's a sort of genetic tendency to develop what we call hypersensitivities, or commonly known as allergies. And that's why some people do fine all year round, and some people develop allergies. It's just how some of the chemistry in the blood is composed, which puts some people at risk for that.
And what are some of those symptoms? It seems like you have a cold, but you really have an allergy?
Yeah, so certainly a lot of the same symptoms of the common cold are symptoms of allergies. So nasal congestion, difficulty breathing through the nose, runny nose, feeling like you've got drainage down the back of your throat, itchy eyes, itchy ears, sneezing, sometimes a cough. Certainly allergy and asthma can go hand in hand. Those are all common symptoms of what we call allergic rhinitis or allergic nose.
And how do you tell the difference? Are there certain tests you can run?
There are tests. Most of the time, a lot of the time, you don't have to rely on allergy testing. You can go by the history. Certainly if somebody comes in and says, gosh, every spring I start to sneeze and my eyes start to itch and they start to water, my nose starts to run, that's a pretty good indication that maybe somebody has tree allergies because they come on in the spring. As opposed to, say, every time my toddler gets sick, I get sick. That's probably just a viral illness, like the common cold. So a lot of times the history can direct you, but sometimes we do obtain allergy testing to get more specific information on what thing. First of all, is it allergy, and second of all, what things are people allergic to, and what times of year do we expect to be worse than others, and that can also help direct our therapy. If your allergy testing shows that you've got bad grass allergy, for instance, then we know coming up in the late spring and summertime, that's going to be your worst time. So we would get more aggressive maybe with allergy medicines in those times. So it helps you tailor your therapeutic goals.
And what's involved when you test somebody? Is it the old patch testing?
Yeah, so essentially what we do is what we call scratch testing. So we apply little scratches, they're not painful, of purified allergen proteins, usually on the forearm. Sometimes it occurs on the back, and then the patient either reacts or they don't. And if they react, it means that they've got certain cells in the tissues underneath the skin that release histamine and are primed with antibodies against whatever it is that you're applying to the skin.
And that reaction is immediate?
Yes, it's very quick. Yeah, so we know right away. For instance, if somebody has an appointment with our allergy lab, I see them right afterward because we'll know right away what things they reacted to and how severely they reacted to them, and then we can we use that to sort of tailor our therapies.
And what can you do for allergies? Just over-the-counter antihistamines?
No, certainly over-the-counter antihistamines are good medicines, and sometimes we use them. I prefer to try controlling nasal allergies with nasal medicines, so typically nasal sprays, which are prescription. Although there is a new one, there is a new over-the-counter nasal spray out now. But however, most of them are prescription. And we try to treat what we call topically, so medicines in the nose, as opposed to when you take pills, then you're susceptible to what we call systemic or all over body side effects.
Right, you get too tired. How do you go to work if you're all dazed out on medication?
Antihistamines, right. So antihistamines certainly can make you drowsy. So I prefer to use nasal sprays, but sometimes we do rely on oral antihistamines.
And could it put you in the hospital?
Allergies can put you in the hospital, especially if they're linked to asthmatic attacks, so difficulty breathing and things like that. But typically, allergy nose, or what we call allergic rhinitis, it just gives you the more nagging symptoms like runny nose, sneezing, those types of things.
Yeah, and everybody hates that.
There's no question. It's a big problem, again, especially in this area, and so we see a lot of allergy patients.
And what's coming up on the horizon for allergies?
Well, what's sort of new in our part of the world, in the United States, is what we call sublingual or under the tongue or oral immunotherapy. So traditionally, if you had allergy shots because your allergies were severe and medicines weren't controlling them, we would have to inject small amounts of the allergens out there in the world that you're allergic to, and then over time, hopefully, we get chemistry changes in the blood so that you don't react to them any longer. What's new now is that in the United States, we're starting to get some FDA approval on oral medicines that accomplish the same thing. So you take a tablet or you take drops under the tongue of purified allergens that you're allergic to, and do that for a long time, and we rely on that to change the chemistry in the blood. So right now, in the United States, there's a grass and a ragweed oral allergy, what we call immunotherapy, equivalent basically to allergy shots. This has been used in Europe for a long time, but it's just now gaining acceptance here in the United States. So that's what's new coming up. There's not a lot of data out there on how it's going, but it has reached FDA approval for those two allergens, grass and ragweed.
So that sounds like that could eliminate your allergy?
Well, whether allergy shots or oral allergy medicines, the goal is to, over time, change the chemistry in the blood so that you don't react to those things. So that's the goal. But certainly, at least symptom control is also achievable with allergy shots or oral immunotherapy. And so you don't have to rely on nasal sprays and oral antihistamines then.
Wow, lots of great things coming out because just about everybody has an
Yeah,
allergy
it's
to deal with.
terrible. Yeah, it's a big problem.
Great. Dr. Erin Brescia with the Ohio Head and Neck Surgeons here in Dover. For Medical Minutes, I'm Jennifer Clark.
Are you suffering from asthma or emphysema? Do you have shortness of breath or a nagging cough you just can't shake? Hi, this is Dr. Nathan Samsa. I'm originally from Strasburg and I've returned after my medical training to serve the Tuscarawas Valley. I'm board certified in pulmonary medicine and I'm ready to treat your breathing and lung problems. My office is located at Union Internal Medicine Specialties, 515 Union Avenue, Suite 187 in Dover, Ohio. Call me at 330-343-4411 for a timely consultation.
Hi, I'm 1450 WJER's Bill Morgan, inviting you to join me on television Wednesday evenings at 7 and Friday afternoons at 5 for TV2 Sports Talk. Sports Talk is your weekly look inside high school football, volleyball, soccer, and more. Look for guest appearances from your favorite area coaches and players. TV2 Sports Talk, Wednesday evenings at 7 and Friday afternoons at 5 on DMG Channel 2 on Time Warner Cable.
Welcome back to Medical Minutes here on Time Warner Cable DMG TV2. And now we are in the Union Hospital's Maternity Center in Dover with nurse manager Donna Morgan. And Donna, we're going to talk about how to safely let your children sleep in cribs. It's a safe sleep initiative. What is that?
Correct. It's a movement that Ohio has started to decrease their infant death mortality rate. I don't know if you remember years ago, we had the Safe Sleep or the Back to Sleep initiative.
Right, because you always wanted a child to be on their back, hence back to sleep.
Correct. But whenever we brought our kids home 15 years ago, we put them on their belly. We had nice little bumper pads in there. We had toys. We had everything to keep them occupied. That's exactly not what you're supposed to do now.
Now, these are babies, and these are not real babies, but these babies are what I would do. Like you said, I wanted to
What
make
we
sure
would
that
have
they were
done.
wrapped tightly in a blanket and they had, like you said, toys and everything with them. Why is this not safe?
They've done a bunch of studies. Nobody really knows what causes SIDS or sudden infant death syndrome. What they do know is that whenever they find kids in the environment, a lot of them are like this. They have the toys, they have the bumper pad, they have everything that's cute and cuddly in their crib.
And why would we do that? Because we want them to feel safe and have something to do as a newborn?
Well, we want it to be cute. We're bringing home this cute little baby. This is cute. This isn't, but this is safe. The initiative is really pushing the ABCs of sleep, and it is alone, on the back, and in the crib. That's the only place, not in the middle of the bed with the pillows around it to make sure the baby doesn't fall off, not on the sofa, not in the car seat, but in a crib with a tight-fitting sheet, in a sleeper. If they're swaddled, they don't have to be swaddled tightly. You don't want that. You just want them to be swaddled or in a sleeper in a crib.
Now, a lot of people will have a fussy baby. And that's why you're exhausted as a new mother. And of course, you just want to lay down for a minute and you take him to bed with you.
Yeah, no, that shouldn't happen. If they're fussy and you've done everything for them, you've fed them, you've changed them, you've bathed them, you've rocked them, they still won't go to sleep. It's okay to put them in the crib, on the back, walk away.
While they're still screaming and crying.
Yeah, it is.
That's got to be the hardest thing for new mothers.
It is, and we're not saying it's easy. It is stressful. Being a new mom is stressful, and having a support system is really the best thing that you can do for that. If you can't handle it anymore, have a friend that you can call. Put the baby in a stroller. Go to the mall. Walk around. Something that will get you out of the house, calm the baby down, or just give you some time away.
And how long should you do this? How old will the babies be in the crib where you can't put a toy in with them?
They say up to a year. Most of the sudden infant death syndromes occur between 1 and 4 months. After 4 months, your risk really goes down, but they're saying to continue this practice until they're a year old.
All right, and then, favorite little toys, like a Lammy, something small, even that we shouldn't put them in with.
Correct.
And so, how do you teach new parents about this?
Well, whenever you tell them that in the state of Ohio, 3 babies die every week from sudden infant death syndrome, it doesn't sound like a big number until that's your baby, and you start thinking of how many kids die every year. If that's your baby, you're going to do this because you don't want your baby to die.
And this looks like a suffocation thing rather than something that has to do with something unexplained.
Right. They still don't know the cause of SIDS, so could it be a little airway obstruction? It could be, especially whenever the kids start moving around, and they can wedge themselves up against the bumper pads. So it's best to be safe.
All right, and cribs, should they be this is a clear plastic crib, because the cribs my kids were in had the spindles.
Right. This is just ours for, it's a bassinet that we use here at the hospital for while they're here. Your cribs should be designed, they should be the most recent manufacturing date. I'm not sure what the inches are, but it's real thin spindles anymore, and no bumper pads at all.
You don't want fingers getting caught, or if they're too far apart, maybe their head would get stuck.
Right, because their head is the biggest part, so what can happen is the baby's body can actually kind of sliver out through those spindles and then trap their heads.
And how often should you check on a sleeping baby? When first child, I checked on them every 5 minutes. When do you make sure that everything is still okay?
Whenever the baby's sleeping, as long as you have them in a safe environment, that's your time to go take a nap too. So they will be okay. You've given them the best possible place to be. And, sometimes unexplained deaths do happen, and that's very unfortunate. But there's not going to be anything you could have done if you're doing the best that you can to give that baby a safe environment to have prevented it.
And how many parents do you think actually follow the ABCs?
Well, that's something that's kind of interesting because, it's not just the parents. It's the babysitters. It's the grandparents. It's the aunts and uncles. It's anybody who has contact when that baby's sleeping that also needs to have that education. So the education is out there, and sometimes it is the grandparents they're like, oh, honey, it'll be fine.
When you were a baby?
Yes, whenever you were a baby, this is what we did, and you were fine. And that's true. Most of the babies are okay. But if that's your baby who is not okay, it's one too many.
Exactly. So if you have questions on how to make sure that your baby is back to sleep alone, on their back, in the crib, ABCs, the Safe Sleep Initiative, Donna Morgan, nurse manager at Union Hospital's Maternity Center, can tell you all about it.
Sure. We are in the process now of educating all of our nurses. They know about back to sleep. The whole safe sleep alone in the crib by themselves is kind of a newer concept, so we're still in the process of educating our nurses, but they can always call us. We're also going to be having some outreaches that we're trying to get out to the community. One of the things we're having is the baby fair this fall. We'll have a table set up that demonstrates safe sleep and answer any questions that they would have there.
All right, very good. Thanks for being on Medical Minutes, Donna Morgan, Union Hospital Maternity Center nurse manager.
For chronic sinusitis sufferers, the idea of going to the hospital for invasive surgery may deter them from getting help. But thanks to Dr. Kurt Guerin, ENT, those days are over. Dr. Guerin is the first ear, nose, and throat specialist in Northeast Ohio to regularly offer balloon sinuplasty right in the comfort of his own office in Dover.
A nursing home or your own home, it's good to be home, so call Ember Complete Care for all your home health needs. When you're recovering from illness or injury, our compassionate staff promotes healing in the most comfortable environment of all, your own home, for skilled nursing, physical therapy, wound care, and more. Locally owned and operated, Ember Complete Care has been servicing all of Tuscarawas and Coshocton County since 1986, with a yearly average of $75,000 donated back into the community. Call 1-800-462-0909. Ember Complete Care. It's good to be home.
Welcome back to Medical Minutes here on Time Warner Cable DMG TV2. This time around, we are with Jeremy Glassner. He is a physical therapist here at the Union Hospital Healthplex. Jeremy, tell me about the Healthplex. What is this place?
It is an outpatient therapy unit. We've been here, actually we're going on our 15th year. I think in about 3 or 4 months it'll be 15 years. We offer physical therapy services, occupational therapy services, and speech therapy services.
What are those services? I mean, do you make people come in speech therapy? You learn how to talk again, occupational therapy? What do you do?
Yeah, it's mainly rehabilitation services. For example, if someone has a surgery, maybe they've had a surgery on their shoulder and they want to get their shoulder moving again, we would be the folks helping them get their shoulder moving again. Or maybe they've had a stroke and they want to get their arm or their leg working better, we would be the folks to help them do that.
And do you have to have some type of ailment to use any of the facilities here?
Well, we have a wellness program as well. So our former patients, we have patients who have come in, they've received therapy, they can actually come in and use our wellness department, and they can come in on their own and exercise and maintain their overall health ongoing.
So all of the benefits, they can keep them and maintain them.
Yeah, that's our goal. Our goal is to get them moving and get them moving well, and then they'll be able to sustain that on their own on an individual basis.
But you also have specific programs that I want to talk about today called Your Move, and that's why capital UHR, Your Move. What is that?
Well, Your Move was designed about a year ago. It is an exercise program designed for people with movement disorders. Now, movement disorders is there's a wide range of movement disorders. Some of the more common movement disorders would be individuals with Parkinson's, individuals with multiple sclerosis, individuals who have had a stroke. We've actually created an exercise program that goes twice a week on Tuesdays and Thursdays, designed specifically for the people with movement disorders.
And how many people typically sign up for Your Move?
Yeah, we've had over 100 to 110 people who've participated in the program over the past year. I would say consistently on every Tuesday and every Thursday, we have 40 to 50 people who come in twice a week.
And what are some of the things they do during Your Move?
Great question. We actually sent 2 of our therapists to Pennsylvania and to Columbus to do specialized training on how to help people with movement disorders. They come in, they set up an exercise program for these folks. They come in classes of 10 to 15, and they put them through, every day is different. I mean, every day changes. One day they may be working on balance. One day they may be working on their hands and their dexterity. I've seen days where they're working on walking, taking big steps with their walking. They seem to change it up every day for these folks, and the folks really enjoy the differences on a day-to-day basis.
And what's the progress like? Do they make fast progress, or does this take a long time?
Yeah, that's a great question. We started this program in September of 2013, and we ran it from September to November. Now here's the crazy thing. We pre-tested all these people in August of last year. We wanted to see what they could do. We wanted to test their walking. We wanted to test their balance. We wanted to test how well they could get out of a chair. We pre-tested them in August. We post-tested them in November. The crazy, unbelievable, we couldn't believe it results were these folks had a 20 to 25% improvement in their balance, in their ability to walk, in their ability to get up, turn around, just their overall ability to do things around the house. We measured them in 5 or 6 different categories. Every category had anywhere from a 10, 20, 25% improvement.
Well, is that because they're so motivated, or does you credit the staff for that?
Well, both, and that's a great question. Both the staff has a specialized training to show people what they need to do, but what we found and this is kind of a byproduct. We didn't know that we'd see this. What we found is that the folks, everybody coming in has a similar problem. And when you are with people who have similar problems, there's a lot of camaraderie that's built. And so if you're having a bad day, I'm having a good day, I may say to you, come on, let's go. You can do it. Let's get in there. Your day just got better. You're working harder because we're motivating one another.
So not only do the patients motivate each other, but the staff as well, and then being able to get out and go somewhere, does that make a big difference for these patients too?
Yeah, the folks really enjoy coming. A lot of them will bring their caregivers, maybe a spouse with them. We've seen some uniqueness in the results. Some of the folks quit coming, and what we'll call and say, is everything okay? And they say, yeah, I started moving so well, I actually got a job, and I found employment. And we've had some great results from what we've seen in just a short period of time. You know, our first class was September to November of last year. We had a class from January to May, and we'll be starting up again this September 9th actually of 2014.
You skip over the holidays?
Yeah, we're starting after Labor Day, and my staff, they like to take this thing called vacation. So we would do it in the summertime, but they'd kill me because they want to go on vacation, which I completely understand. So we're going to start the Tuesday after the Labor Day week, and then we go until Thanksgiving.
And do you need a doctor to refer you? Do you just call you up?
Yeah, if they just call the HealthPlex and they ask for Jeremy, I can get them set up. What we do is we're putting their name on a list. We'll give them a call in August, and we'll say, hey, we'd like for you to come to such and such class. The program is getting so big that we're offering now 5 classes beginning this September. We'll have 5 separate classes on Tuesday and 5 separate classes on Thursday.
Well, I'm glad that you're expanding and being able to reach out to the community, but we have that many people that need help?
Yeah, the percentage of people with a movement disorder across the nation is close to 13 to 14%. So 13 to 14% of the folks have a movement disorder. That doesn't mean 13 to 14% have Parkinson's, but 13 to 14% have a movement disorder. If there are 100,000 people in Tuscarawas County, there should be 13 to 14,000 people that we believe we can make an impact in their life. Not that many have Parkinson's, not that many have multiple sclerosis, not that many have a stroke, but there are a lot of folks that this class is geared to make a difference.
What's the most difficult thing to do?
The most challenging thing, you know, when someone's having a bad day, and maybe we're working together as partners, and I can't get you to be your best. As a staff, we really work hard to get you to be your best, to do your best, and to do as well as you can. That way you can reach the potential that you've got.
So you're saying that every exercise they do, they love it?
You'd have to ask some of the participants. You know, I think they really enjoy it. I can tell you that they work hard. I mean, they work hard. This isn't a day spa. I mean, people come in and they work hard and they exercise, but they're only asked to work as hard as what they can do. You see, we have folks here who come in and they run 5K races. We have folks who come in and they're in a wheelchair. So we try to individualize each exercise based on that person's capabilities.
Well, it sounds like you have the right recipe to help just about everybody.
We're trying. We're getting better. We've had 2 classes already behind us. This coming year, we're going to partner with someone to help do Tai Chi for the individuals with the movement disorders. We're hoping to work on different programming, other programming, which we haven't really released yet, but we're in the works of making it better and better and better. And we think we're getting there.
Great. That's the Your Move program here at the HealthPlex at Union Hospital. Jeremy Klassner, our physical therapist, thanks for being on Medical Minutes.
My pleasure. Thank you much.